So one of the things you talked about, Brett, and I would appreciate Chris's perspective on this as well, was education. And obviously, being at Pepperdine, that's something that's very important to us and something we work daily on trying to support and resolve. And on your graph, it showed in Los Angeles that actually up through high school and GED, LA County has a higher percentage of folks that make it to that level. But then there's a huge drop-off when you start going to community college, graduate school. What's driving that in LA, and what can we do to fix that?
Yeah, immigration, of course, is the biggest contributor. Sure. We very much have our skill base in Los Angeles is very barbell. Quite a few people with advanced degrees, quite a few people without even a high school degree. Most of those folks are in fact Hispanic, from Latin America, Central America, things like that. And I realize that it's interesting. We're back in the whole immigration debate right now, and I've had this conversation with people before. People say, well, shouldn't we toughen up on immigration? Shouldn't we, these people are a big expense, they're causing low skilled in our work base, blah, blah, blah. Immigration is here, and it's functionally here to stay. And in many ways, I think that if you think about advancing our education system for these kids, it's an investment, not an expense. I think the way to think about it is that as our population continues to age, we need to widen out the bottom of that population pyramid. And in many ways, these kids are the future. That it will help support our ability to enjoy the government services that have been promised to us when we retire. So, I think it's a necessary investment for the long run.
I'd also add that we have to have a fundamental grassroots movement, and I would agree with Chris that it's a demographics issue. And what we have to address is that I would assume that most people in this room, there was never a question of whether if you would go to college, it was a matter of where you would go to college. We have a fundamental a generation of certain segments of the population that don't think that way. They never see the possibility. How do we get over that? There has to be a grassroots movement to help them understand that education is a key that opens the door to the new economy, and that's a hard thing to understand.
It's an interesting point you make, because I recall when I was in graduate school, someone asked me, when did you decide you were going to college? And I thought that was the strangest question I'd ever heard, because I had known since I could remember that that's what I was going to do someday. So it's important cultural change beyond just what we do in the education system. Yes, question.
Hi. Question for both of you, actually. We operate a number of medical office buildings throughout LA County and some outside the county. And all the doctors I talk to think that the healthcare entitlement plan of the government is actually going to fail after 2 or 3 years, just due to the sheer dollar volume it would cost to fund it. So where do you guys see that going as a trend? Is it going to create a lot of jobs, and then is it going to implode due to the deficits? What's going to happen?
Understand that our healthcare system was in crisis, has been in crisis for the last 15, 20 years, and it's not a crisis of insurance, it's a crisis of consumption. We spend vastly more than any other developed country on healthcare, and yet we have worse health outcomes. And this isn't administrators wasting, it's just that frankly Americans overconsume medical services. If you have insurance, you feel like you're entitled to anything, anywhere, anytime, no matter what. Clearly, you have to inject some rational decision-making, rationing if you want to call it, I don't care, into the process. Now, this package, when it was originally sort of brought forward by the president, had some provisions in there for putting some basic controls on consumption, which of course immediately caused Republicans, who are supposed to be fiscally conservative, to start screaming about death panels. By the way, I think death panels are a wonderful idea. I fully approve. Fully support.
We have that on tape, I think. Yes.
But be that as it may, those were removed from the bill. And so yes, the bill is awful. But I like to say this, before we had a festering wound underneath the scab. And what this bill has done more than anything else is, I would argue, and pardon I know it's early in the morning, but it's ripped the scab off of it. And from that perspective, at least we've begun the process of starting to deal with the issues. This is not going to be the final round of healthcare reform, not by any stretch of the imagination. You're going to see multiple rounds of this as we struggle to deal with it. But at least the process is beginning. Because frankly, over the last 20 years, last two administrations, Clinton tried to do something about it, and they handled it horribly, failed, and walked away from it. And Bush just made it worse. So, at least something was done.
And recognizably, this problem is going to get much more important because of that 29% of the population born 1946 to 64 going into the baby boomers going into the most heavy medical use years of their lives.
Question here.
Good morning.
Just a follow-up.
Sure.
Real quick while we're on healthcare, so.
We're expanding a lot of suites for a lot of doctors. They're not quite onto the whole idea of medical records yet because they don't have the money to get into the medical records arena. But we're seeing this growth in their space, and their rents haven't really declined. And I'm not saying I'm just a good negotiator. I think it's just a matter of they need the space and they think they can afford it. They're not really relying on the money that's coming from the government. They think they're going to do it internally. But do you see all of this expanded space, these 30 million people, some say 6 million in California, maybe that's 3 million in Los Angeles, all going to see a doctor, and that's going to require more space? I've seen projections along those lines, but healthcare growth and employment seems to be up. So is that going to be something that's going to pull us out? Is that part of your sector of professional services?
It's really hard to say from a 30,000-foot level on sort of the space needs. As Brad said, we are starting to see the boomers move into retirement, which should, as the population ages, you should see more demand. And frankly, with all the technological innovation going on and all the new services that are being created, that too should increase demand. On the other hand, we always look at pharmaceutical products, drugs, as somehow being essential, but in some cases they are. But the one thing about pills that we don't really appreciate is taking a pill may prevent you from going to a hospital or going to a doctor's office, which can be a phenomenal space saver from your perspective. The answer is, I don't know. But I think you could look at it two different ways.
We know that automation of medical records, for example, is one of the things that's in that bill, and that's a huge obstacle. I mean, you've got multiple different systems they're talking about trying to integrate for one system. A huge obstacle, but I think that would be a big part of reducing the space demand.
I would say is one thing that doctors, not unlike economists, aren't necessarily the best business people. So who knows?
I just want to circle back for a second to the healthcare discussion, really because my husband and I were just talking about this last night, as a potential job creation opportunity. You have so many more folks going on to healthcare hopefully in the future, and the reality is I think a lot of grassroots folks who haven't been to the doctor in the 15 years we've been struggling with the healthcare situation are going to go just for a checkup. And so we were talking about what's going to happen with that gap in folks that are prepared to provide those services. I was watching your presentation on the educational attainment gap. And so how might we, or do you think it's an opportunity for us as a state to look at how we push our legislators to do something around healthcare education so people are prepared for those new jobs coming up? And it's not just doctors, as you know, there's a variety.
Yeah, go ahead. Well,
we did a study that looked at this very issue. We did gap analysis looking at the available supply of healthcare workers. We were specifically looking at allied healthcare workers as a segment of population lower than nurses, but above the food techs. So all your technologists, technicians, and we clearly found there was around 80 to 82% of supply would be met by existing by 2030. But we identified that there was a clear gap. We have to make a decision. Do we want to send Californians outside the state to look for training, to be able to take jobs here in their own state? Or are we going to allow other people to come in? Because we will. California will get the workers. We'll bring them in from Iowa, which isn't as an attractive place. Wonderful place to live in, I don't say anything bad about it, but California attracts more people to it. We'll fill those jobs, but it won't be Californians. So what we need to do is studies like that help legislators understand that if you want to improve the quality of life of existing Californians, you have to create the opportunity to fill the jobs of tomorrow.
And frankly, one of the healthcare problems with the healthcare system is that there are segments of the healthcare system that have deliberately restricted supply. Medical doctors in Europe do 5 years of training, and they're perfectly adequate at their jobs. Here, we insist on them going through 8 or 9 or 10 years of training, and then they come out and demand $400,000 a year because of all the time they spent training. I mean, it's insanity. And clearly, you could change the regulatory barriers, particularly in the medical programs, to make it easier for people to get in, make it easier for you to get down. By increasing the supply, you also reduce the cost to some extent. And obviously, that would be a way of going about doing it too. But again, the EMA has more clout than I do.
My real question is about the knowledge-based economy or the knowledge-based jobs. I hear you, but can we really expect that on a person-for-person level to replace manufacturing. Because my concern is we keep losing jobs, whether it's to offshore or to automation. I don't see us creating the same number of new jobs, and yet the population keeps growing.
Yeah, this is the, in economics there's a term for this, it's called the fixed jobs fallacy, or fixed number of jobs fallacy. And the idea is, yeah, somehow or other, X number of jobs are created per year, and if you get one of those jobs, great. If not, you're done for. And hence, death committees, right? But realistically, if people want to work, the economy will expand eventually. It may take a year or 2 or 3. Will expand to provide that person a job. Now, the key here is that the equilibrium system is one of wages. So if you have a lot of low-skilled people, the economy will expand to give these low-skilled people jobs, but it will do so through lower wages. Hence, you see a broadening of the wages between the haves and the have-nots. And hence, Brad's discussion about increasing the education and educational investment. Because in many ways, reducing the number of unskilled people in our economy is not only good for those individuals, but it's also good for the unskilled people who remain. Because by reducing the supply of those folks, you increase their ability to make a living. So in a sense, if you have lots of skilled people, I mean, I know we all have this idea of, Russia, where you have PhDs in physics driving taxi cabs. But this isn't Russia, it's the United States, and I know Gary thinks we're moving in that direction, but...
Well, we do have a lot of recent college graduates who are working part-time.
Well, right now, but of course,
it does exist here.
But now, don't confuse the trends and the bends. That's a function of the current cycle. When we get out of this mess, the economy starts moving forward again. And I think that's one of the key points you got to take away from this whole conversation. There are folks out there who talk about how, U.S. economy is not going to grow for 20 years, and that's it. And that's not what we're saying by any stretch of the imagination. What we're saying is that the problems that are hurting the economy today are substantial and remain, and will continue to dampen growth for the next couple of years. But when we come out of that, the fundamentals of this economy are still strong. The fundamentals in California are still very strong. And from that perspective, when growth does return, jobs will be created for people who want jobs. And unemployment will go back to what they call the natural rate, which has to do with just frictional changes in the labor market. That will happen. But there is this issue with the education gap that will come back to haunt us, because when we do come out of this mess, we're not going to have the housing sector to provide low-skilled people with those high-paid jobs the way manufacturing did 20 years ago. So in a sense, we come out of this, the labor market is going to expand, but at the same time, you're going to see that wage gap expanding at an even more rapid pace. And the differences are a social issue as well as an economic one for our area and our nation overall.
Thank you very much. Let's thank Chris and Brad for